Hello. Thank you for reaching out to me and asking for some techniques on how to relieve some back pain. Unfortunately, with everything going on right now, I can't really give anybody in-person advice on how to do this kind of stuff, so I'm going to make you a little video. And since I don't want to put anybody at risk, especially a pregnant person, I have my wonderful husband here who's going to act as my pregnant person for this demonstration. So definitely reach out to me if you have any follow-up questions. I also just want to state, if you have severe back pain or don't feel comfortable doing any of these things, definitely know that this is in no way in place of medical advice, and you should definitely speak with your medical doctor if you are not seeing relief from this, or if you have worse back pain following these exercises. But here are just a couple of quick things that you can do at home with no real equipment to give you some additional relief to back pain. What can also help is an exercise ball. So if you don't have one, then definitely invest in one if you're able to do so. It can also help you in your birthing process by bouncing on an exercise ball, improving your pelvic floor muscles and your relationship to the ground. It can sometimes make labor quite a bit easier. So we are going to start. Let me just get this set up. So I'm just going to ask my husband, my pregnant person, to get on all fours for the first exercises. So on all fours, you'll want to have your knees shoulder width apart. No, go a little bit closer. A little bit closer. Okay, perfect. And you'll want to be sitting up completely. So butt up in the air. You don't want to squat down and be sitting on your knees. I know that this can be uncomfortable, so a modified position of this, if you do have an exercise ball, or I can show you a position on the couch as well, would be to lean over that exercise ball or to lean up onto the couch. So for this exercise, all you'll need is a blanket. If you have a rebozo or a large scarf, then you'll want that. Just something where the width will be able to cover your entire belly. And I'm sorry if you see my cats throughout this video. They're very curious as to what we're doing. So for this purpose, I'm going to take a throw blanket and just fold it in half. Put it underneath your belly. So obviously you need a partner to do this exercise. And so you're going to want to make sure that it covers your whole belly. So what you don't want to do is have it folded thinly so that it's going across thinly one area of your belly, because you want to put pressure evenly right from under your boobs down to your pelvis below where your belly is bulging out. So you'll want to make sure that it's full. And then definitely check with your partner to let them know that you are comfortable in this position. And then what they're going to want to do is grab the ends of the blanket. Right? No. You put your hand up. Sorry, we haven't rehearsed this. So your partner will grab the ends of the blanket. You as the pregnant person, just keep yourself comfortable on the ground. And then they'll want to pull up. And they're going to want to do that for however long it's comfortable for you. So the purpose is that they're lifting your belly up so that it's not hanging down, so that that pressure is not being put on your back, on your tailbone. It's just going to relieve some of that by lifting the belly. So you're going to feel it a little bit in your stomach. It's going to lift backwards toward your spine. They're going to lift that. You can do it as long or for as short amount of time as you would like, but it will provide you some instant relief. Now, definitely know that when your partner releases your belly, you probably will start to experience some pain again, but again, these are kind of instant reliefs to give you some sort of relief from the back pain you're experiencing. So using the same blanket, your partner can kneel behind you. So you're in the same position, and your partner can use that blanket and cover your lower back and your butt. So they'll wrap it around lower back and your butt. And again, they're going to squeeze the ends of it on either side and go back and forth. And this is a sifting motion. So this is going to relieve if you have lower back pains into your tailbone or your sciatic area. Just sift back and forth. It works well if the blanket is gripping to you and not necessarily moving back and forth a lot. So that motion is pulled down in the motion of your legs in the same direction as your legs, down and then back and forth, so that it's staying and your lower back is moving with it. So we're gonna get a little bit closer here, right up on your butt. So this next technique is a little bit of counter pressure. So counter pressure, again, this is something that you'll wanna do with a partner that you're comfortable with because they're all up in your butt area. But if you've had kids, that probably doesn't matter to you anyways. There's no boundaries when you're in labor. So for counter pressure areas, you're gonna wanna go in that same area that the sifting is. You're going to wanna go just on the outer sides of the hips. Your partner will wanna get a good stance on their knees, or they can be standing if they need a little extra pressure and kind of straddling over your hips. They're going to want to take their hands like this in this position and push your hips inward toward each other. So this is also going to provide relief for your lower back, for your sciatic area. They're going to push that together because as you get further in your pregnancy, your hips are widening a little bit. It's something that your body's not necessarily familiar with, especially if this is your first child, and it's something your bones are just adjusting to all of that. So by giving them a little bit of a reset and relieving some of that pressure, it's just going to alleviate some of that lower back pain. So these are the 3 techniques that I would recommend at this time very quickly. You can also do some things for some long-term relief, such as, I know right now, obviously, there's no massages. There may even be risks with chiropractic right now, but those are definitely great options if they're available to you. Additionally, there are things that you can purchase on Amazon or other places that you can buy baby items. They're slings for your belly. They go around the lower area of your belly right down here to lift up so that it has some relief and it's not so much pressure again on your lower back. You can sit for me regularly. I will create some more videos as I think of some more techniques to help you get some relief. But the last position I want to show you is the modified all fours position. So there are different, if you've had a baby before, you know that there are different ways that you can labor as well. So if you'd like some information on different positions that you can be in to give labor, then I can absolutely make another video with my trusted pregnant person in quarantine. But the modified position for the all fours position for those techniques that I just showed you is just up against your couch. So I'll do this one, you don't have to worry about it. So what that's going to be like is, again, you're going to want your back to be flat so that your belly's hanging down, but instead of putting that pressure on your hands on the floor, you're just going to be leaned like this. You can even rest your head if you'd like to, let your belly hang down so that the most of your pressure is going to be placed on the couch or somewhere comfortable for you. So again, if you have any questions, feel free to reach out to me. I hope that this was helpful. If you have more questions about the positions or anything else, definitely let me know. Thank you.